The American people want honesty. If it's bad news, they'll take it. And they're going to be stronger on how they're going to respond to it. But when they get lied to, and they think something's coming, or they're going to be protected, or a mom with a kid with cancer thinks they're going to have care, and then it gets taken away like that, then what? Just own up. If that's what you want to do, own up to it. Donald Trump is now the president of the United States. He won the election. My Republican colleagues in the Senate won the election. They control the votes in this chamber. They control the votes in the House. That's why we're seeing these budget resolutions. All I'm saying is own up to what you want to do. You want to do it. Just be honest with the American people about what's going on. Where you told the Department of Commerce Office of Inspector General in their investigation that you, quote, definitely felt like our jobs were on the line, close quote. And while you did not like it, you would make the same decision again to edit a less inflammatory statement as the least bad option. Mr. Jacobs, or Dr. Jacobs, do I have it right? Is that correct?
That's what the IG report found, yes.
That you would do nothing differently? Mr. Kirkland, do you know how many Navajo brothers and sisters are waiting to have water delivered from the Navajo Gallup Water Project?
I can't give you that.
I'll give it to you. I have it.
I look
250,000.
forward for you giving it to me.
It's 250,000, sir. Mr. Kirkland, do you know how many recognized Indian water right settlements are in New Mexico?
I'm sure you have that number for me. I look forward to hearing it.
I'll share that with you. Mr. Kirkland, do you know how much funding is needed for the FY26 budget to keep the Navajo Gallup Water Project on track?
I'll look forward to hearing.
$175 million. Do you know that if this fails, it would be the first Indian water right settlement to fail in America's history?
No, sir, I was not aware of that.
It would be. Mr. Kirkland, do you know how much the president's budget, President Donald Trump, allocated for the Navajo Gallup Water Project?
Not offhand, no, sir.
$0. Is that okay?
I'm sorry?
Is that okay that the budget had $0 for the Navajo Nation water pipeline settlement?
Sir, if it was, I hope that we can put trillions of dollars into not just the Navajo's budget, but the Office of Indian Affairs. The facts are that
I agree with you.
Our nation is facing a crippling national debt.
Okay, I don't know how to read that, so yes.
As I stated before, I look forward to working with you.
Mr. Kirkland, my
committee, and
Republican
your
colleagues
staff.
just added $4 trillion to the debt, man. My question is, you in your testimony proudly spoke of your upbringing on the Navajo Nation, your ties to the nation, hauling water. Speaker Curley's right behind you. Other leaders are as well. One of the things I'm proud to represent is the leadership from the Navajo Nation, brothers and sisters there as well. For too long, America has ignored its trust responsibilities. This would be the first water settlement to fail. Project 2025 has outlined a plan to commercialize the forecasting, which would force American taxpayers to pay private companies to access weather forecasts. Dr. Jacobs and Mr. Jordan, yes or no, do you think Americans should have to pay to access forecasting data, protect the safety of their families and homes from natural disasters? Dr. Jacobs?
No, I think that that's an essential service that all Americans deserve.
Mr. Jordan?
I agree, no.
Dr. Jacobs, in late May, I sent a letter to the National Weather Service along with several of my colleagues regarding the National Weather Service's decision to discontinue translations of weather alerts and forecasts into languages other than English. Those services have now been restored. This created a dangerous gap in access to emergency information for those nearly 68 million people in the United States that speak a language other than English at home. Yes or no, do you agree that people deserve to get emergency alerts in the language that they can understand?
Yes.
Yes or no, do you commit to ensuring that this lapse in translation doesn't happen again?
If confirmed, making sure that the watches and warnings go out and they're understood is definitely a priority.
Appreciate that. On September 1st, 2019, when you were NOAA's acting administrator, President Trump erroneously tweeted that Alabama had been hit hard by Hurricane Dorian. Shortly after, the National Weather Service Birmingham office issued the accurate statement, quote, Alabama will not see any impacts from Dorian. 3 days later, President Trump went on TV and displayed a weather map altered with a black Sharpie line to show that Dorian would hit Alabama. 2 days after that, you helped draft a release, an unsigned NOAA statement rebuking the Birmingham NWS and repeating President Trump's baseless claim that Hurricane Dorian could impact Alabama. Where you told the Department of Commerce Office of Inspector General in their investigation that you, quote, definitely felt like our jobs were on the line, close quote. And while you did not like it, you would make the same decision again to edit a less inflammatory statement as the least bad option. Mr. Jacobs or Dr. Jacobs, do I have it right? Is that correct?
That's what the IG report found, yes.
That you would do nothing differently?
I mean, there's probably some things I would do differently, and there's a lot of things that I did after that to, I guess, change any potential future outcome. One of them was revamp.
Let me ask this question, because I just had constituents die in New Mexico. We had constituents die in Texas. Would you sign off on an inaccurate statement due to political pressure in the same event, yes or no?
No.
I appreciate that very much. Mr. Kumar, Congress appropriated over $68 million to MBDA under the most recent funding bill. But now the Secretary Lutnick and the Trump administration have dismantled the MBDA, ignoring the law Congress passed in 2021. When Deputy Secretary DeBar was before this committee in May, he committed to, quote, follow every dollar and report back to this committee regarding the status of MBDA. I have a letter here that I plan to send to Deputy Secretary, holding him to this commitment and asking a series of questions regarding MBDA funds and grants. Mr. Kumar, if confirmed, you'll be responsible for overseeing the department's responses to Congress, yes or no?
Thank you for the question, Senator. Yes, I will be.
So yes or no, will you commit to me that my colleagues and I will have the report Deputy Secretary DeBar promised regarding the status of MBDA funds and complete answers to other questions within 2 weeks of your confirmation, if not before?
Thank you for the question. If confirmed, I will go back to Deputy Secretary DeBar on the letter you mentioned.
We'll get a response within 2 weeks?
I will make sure to get with him right away and try to provide as timely a response as possible.
As timely a response, less than 2 months?
Thank you for the, I will do my best to get it in the stated timeline.
Less than 6 months?
Again, I will do my best to get it to you in the stated timeline.
Thank you, Madam Chair. It's challenging when given an amount of time to respond timely, when all of these witnesses take oaths that they will respond timely to this committee, but when we even extend that time, that a simple answer of yes is just cannot be found. It's frustrating. Dr. Oz, as I shared with you, New Mexico now has 33 people with confirmed cases of measles. Cases have now spread to a new county in New Mexico. One New Mexican has died of measles, a child. In West Texas, the South Plains of Texas, 223 cases. Child has unfortunately died in the state of Texas. My question is simple. Yes or no, do you believe the measles vaccine is safe?
Yes.
Yes or no, do you believe the measles vaccine is the most effective way to protect against infection?
It is, but if I could mention, as we discussed last night, and I think it's important to remember, CMS really should not be opining its own opinion or sharing its own thoughts on vaccines. Our job is to follow the rules. So if the CDC is making decisions about the use of a vaccine, and that's what's agreed on by the experts there, my job, if it confirmed, is to make sure we pay for those vaccines, seniors and for children.
Now, my colleagues and I have written twice to the Secretary of Health and Human Services to do more to address measles. There's not been a response. The same question asked of you today, if confirmed, would you respond to letters from members of this committee? I appreciate your strong response. Yes. It might surprise the American people that Senator Kennedy or Secretary Kennedy said the same thing. So, Mr. Secretary, if you're watching today, respond to the damn letter. People are dying. I'm going to get back to the questions, Dr. Raj. The next question I had was to ask how many people need to die before the administration takes it seriously. I'm not going to ask you that. But I would like to enter into the record an article from The Atlantic detailing the story of a Texas father who just lost his daughter to measles, Mr. Chairman.
Without objection.
Now, Dr. Oz, I believe Medicaid is on the chopping block because of the Republican budget. And Mr. Chairman, I would like to ask to enter into the record the Republican budget resolution which passed on February 25th, 2025, a letter from the Congressional Budget Office, March 5th, 2025, and an article from the Kaiser Family Foundation explaining the congressional budget letter from March 7th, 2025.
Without objection.
Dr. Oz, I'm going to give these to you because you were asked a question earlier about cuts to Medicaid, not being aware, and I believe your response was something along the lines of not being aware of what House Republicans did. Here's some material to read that explains what just happened. So I'm going to share this to you as well. That's why I entered into the record. Now, Dr. Oz, rural hospitals are in dire straits. We've heard from Democrats and Republicans today. Now, they rely on Medicaid to stay afloat. Now, yes or no, do you support Medicaid cuts when they will lead to rural hospital closures?
I don't want rural hospitals to close unless we have a better option. But if I could offer a thought here, this is a good example where maybe there's an innovative approach that might work. I have been talking to hospital systems, and one idea that comes up in rural systems is they don't feel like they've got a partner that maybe is a larger academic center or a bigger institution that might have resources for them to do best practices exchanges. So imagine a rural hospital in central New Mexico, maybe around Mesa Verde, where you actually can have a partner that's in Phoenix or Salt Lake City or Dallas, and that could be your partner hospital. So when you need telemedicine services, they're there. They're not just there, digitally. They've been there. They know the institution. They know the people. They develop a camaraderie that allows them to thrive. We have to revisit how we deliver rural care in America. We can't depend on 100-bed hospitals that do one delivery a day to provide state-of-the-art care. So I share your concerns about losing these institutions. I think we should look at additional alternatives to make them strong. But Americans in rural areas, and I have heard it, even in my office visits from every single one of the senators in large rural constituencies.
So Dr. Oz, I'll ask a follow-up to Dr. Cassidy's question, or I'm sorry, to Senator Tillis's questions in conversation. Dr. Oz, will you stand against changes that will lower health outcomes to the programs that you will oversee?
Yes.
Should physicians or insurance companies dictate the care that a patient receives?
I'm sorry,
Should physicians or insurance companies dictate the care that a patient receives?
Physicians.
I appreciate that. I agree with that. Yes or no, will you continue to defend Medicare drug pricing negotiation programs in court?
It's the law. I'm going to defend it and use it.
Yes or no, will you commit to the process of negotiating prescription drug prices in Medicare?
I'm going to look, as the president has instructed me to already, for every single way that we can reduce drug prices. And there are lots of options available. I feel compelled to pursue every one of them.
I'll ask you one more time because I think I heard it, but I'll give you another chance. Yes or no, will you commit to the process of negotiating prescription drug prices in Medicare?
Senator, it's one of many approaches I want to use.
I appreciate it. I thought you might say yes a second time, but it's not yes or no. So from you, that's fine. Yes or no, do you believe that healthcare decisions, well, I already asked that one, Dr. Oz. Look, as we get through all of this, I have a series of questions that I have put together, not coming into this committee for, based on Senator Hassan's questions. I'll submit them into the record. I have a lot of concerns in these spaces. I won't get to it now. I appreciated having a conversation with you. I'm very concerned of this back and forth of my colleagues saying that they're going to not cut Medicaid or cut it, when Republicans are voting for it. Those are the realities. And as I shared with you, Dr. Oz, one thing that I've learned about Washington, D.C., the way that this place works better is when people keep their word, when people are honest. The American people want honesty. If it's bad news, they'll take it. And they're going to be stronger on how they're going to respond to it. But when they get lied to, and they think something's coming or they're going to be protected, or a mom with a kid with cancer thinks they're going to have care, and then it gets taken away like that, then what? Just own up. If that's what you want to do, own up to it and admit it. But stop lying to the American people is what I keep saying to all my colleagues, anyone that will listen. God bless you and your family. I appreciate you being here today. Mr. Greer, it's been less than a week since President Trump started this, what I'll describe as a reckless tariff war. It certainly feels that way. Families are seeing higher costs. Businesses across the country are hurting, and we've seen one of the worst drops in the stock market in over 35 years. Do you believe that there's currently higher costs a week after the president put these tariffs into place?
Senator, we haven't yet seen how those costs are going to be allocated between the foreign producers and their importers here. We haven't seen the data on that yet.
Do you believe businesses are hurting a week after President Trump put these tariffs into place?
I've heard from a lot of businesses. Some of them are excited about the prospects. Some are concerned because they're import dependent instead of U.S. product dependent. So I know there are varying views on this.
Let me ask this question, because this one's based completely on fact, on something I think you look at every day. You probably have some of these numbers in your phone that I'm guessing might be in your pocket. Have we seen one of the worst drops in the stock market in over 35 years?
We've certainly seen volatility.
Have we seen one of the worst drops in the stock market in over 35 years?
I think, and Senator
can't say
Warner
yes.
talked about
We'll move
this.
on. If you don't want-
Well, I know everyone's concerned about Wall Street, and I'm just concerned about Main Street and getting these jobs
Okay, let's
back,
talk
sir.
about Main Street, Mr. Greer. Last time you were here, I asked if President Trump's trade war would hurt New Mexico businesses and families. You dodged my question. You told me, quote, I can't guarantee economic outcomes. When I pressed you, you told me that you want me to, quote, you asked me to, quote, hear from me on what the impacts of these tariffs are. Well, Mr. Greer, I'm here to tell you today, New Mexicans are hurting. I understand why you would not guarantee that New Mexicans wouldn't be hurt, because you probably knew what I thought then that we now see today, that this is hurting people back home. Now, I want to ask you the same question again. Yes or no, will President Trump's tariffs harm New Mexican businesses and families?
Senator, I just don't think they will. Right now, you have duty-free trade with Canada and Mexico, where they comply with the rules, where they have U.S., Mexican, and American content. I mean, this is designed, and I would hope that being a border state, this is something that you find valuable, and that's what we're trying to do. We're trying to incentivize production in the United States. We want North America to be competitive, and this is. We can't have the status quo. We have to have a situation where we have manufacturing here, where we have foreign market access for our producers, and we want New Mexico families and companies and communities to prosper.
Mr. Greer, do you agree with President Trump that families are going to have to feel a little pain?
I'm not going to speak for the president.
I didn't ask for you to speak for him. I know none of you have the courage to stand up to him. What I'm asking you, Mr. Greer, is do you agree with what the president said about these tariffs, in that people are going to have to feel a little pain? That's my question.
If we have companies that feel pain because they're adjusting their supply chains, have more American product made by American workers, that's an adjustment we have to make to prepare for the future. We can't keep doing the same thing we always did. And if companies are having trouble adjusting their supply chains, which I'm very sensitive to, this is something that we have to deal with. We can't do nothing for 4 years like we saw under Biden, where there was just nothing going on trade.
Let me ask the question a little differently. Yes or no? Do you agree with President Trump when he said families are going to have to feel a little pain?
Of course, I agree with the president.
Thank you very much.
But I expect that the jobs we see for manufacturing is going to far
I'm short
outweigh
on time,
anything.
sir. So
Yes,
look,
sir.
economists are predicting that Trump's trade war is going to cost American families about $4,000 per year. I disagree with your assessment now, and agreeing with Donald Trump that families should feel pain. When I asked you about the economic impact to families back home, you said, no, they're going to do great. Things are going to be wonderful. New Mexico should be appreciative of all these things. I guess pain is the kind of relief that you believe that families should be going through. I mean, it is what it is. As I've been saying to my colleagues here, I understand the outcome of this last election. Donald Trump is now the president of the United States. He won the election. My Republican colleagues in the Senate won the election. They control the votes in this chamber. They control the votes in the House. That's why we're seeing these budget resolutions. All I'm saying is own up to what you want to do. You want to do it. Just be honest with the American people about what's going on. I appreciate the time today, Mr. Chairman. I yield back.
The same economists who are crying out now were the ones who said we were going to crash the economy, and Trump won. We put tariffs on China, and real median household income went up for Americans by $7,000. Inflation went down, unemployment went down. So we have history showing that we know how to use this. We know how to
Mr.
use
Chairman,
these
since
tools.
Mr. Greer went on, I will just follow up again. Then help explain the pain that people are feeling today with your assessment of what Donald Trump said, that families should feel some pain. That's all okay with you all? Mr. Kirtland, from 2009 to 2013, you worked for Ralph Reed's Faith and Freedom Coalition. Is that correct?
Yes, sir.
Was Ralph Reed a champion of tribes?
When I worked for Ralph Reed,
That's not my question. My question is Ralph Reed a champion of tribes?
Sir, I worked for the Faith and Freedom Coalition.
Do you have an opinion about Ralph Reed?
I have an opinion that I work.
Let me ask you a different question. Ralph Reed was a business partner of Jack Abramoff. Both were accused of defrauding and disadvantaging tribal gaming enterprises for financial gain in the early 2000s. something this committee conducted extensive oversight on and produced a 350-page report. Why did you choose to go work for him after that?
Thank you for your question, Senator. When I worked for the Faith and Freedom Coalition, we focused on working with and educating voters on matters of faith that were important to the faith-based community. I've never met Jack Abramoff or conducted any business with him.
My question, Mr. Kirtland, is why did you choose to go back to work for Jack or for Ralph after that?
Senator, I never chose to go back to work for Jack.
Did you accept the job?
Senator, I've never met Jack Abramoff.
Not Jack, Mr. Reed. That's the group you said you worked for.
I worked for the Faith and Freedom
Why
Coalition.
did you
yes, sir.
choose to go work for him?
Why did I choose to work for Ralph Reed? I worked for the Faith and Freedom Coalition, of which he happened to be the chairperson at the time.
You didn't work for Ralph?
I worked for the Faith and Freedom Coalition, sir.
Do you have an opinion about Jack Abramoff?
I never met Jack Abramoff.
Do you have an opinion of him?
I don't know
Do
Jack
you think
Abramoff.
it was okay that he defrauded tribes?
I don't think it's okay to defraud anyone. I've never met Jack Abramoff.
I appreciate that. We're on the same page there. Mr. Kirkland, you say in your testimony that when you worked at the White House, you worked to ensure that the Indian country was fully included in CARES Act, piece of legislation I was proud to work on. The CARES Act, of course, was a bipartisan piece of legislation to respond to COVID-19, to the pandemic, which began in late 2019 and early 2000. I see from your committee questionnaire that you worked at the White House from January 2017 to August 2019. Is that correct?
Yes.
When was the CARES Act passed?
Sir, when I left the White House, I worked on the campaign and remained in close contact with the Office of Intergovernmental Affairs on tribal
Mr.
relations.
Kirkland, my question is, do you know when the CARES Act was passed?
It was after I left the White House.
It was March of 2020, after you left the White House. Why do you take credit for working on that after you left?
Because I worked with the White House to do that.
Who did you work with here in Congress?
I worked within the White House. I worked with Doug Holscher.
Did you work with anyone here in Congress to get that passed?
No, sir.
No? My colleague who had the seat before me, Tom Udall, was the vice chair of this committee, worked to ensure it got passed. Are you aware that during your time in the White House that it was the House of Representatives that passed the CARES Act? The Senate had not yet passed it?
I'm very aware, sir, that the two bodies in Congress passed bills, yes.
No, are you aware that the House passed it before you left the White House and the Senate passed it after you left the White House?
That's excellent. Thank you for telling me that.
Did you work on the House legislation or the Senate legislation?
Sir,
With your advocacy with the White House?
I said I worked with the White House.
Yeah, did you work with the White House on the House legislation or the Senate legislation?
I worked with the White House on formulating and ensuring that all of Indian country was included in the CARES Act.
What did the White House have to do with passing the CARES Act in the Congress?
Sir, we met with and talked with and consulted with tribes across the country, not just federally recognized tribes, but also Alaska ANCs, and that was meaningful consultation. There was lots of time and effort to ensure that they were all included in the act.
Appreciate that, Mr. Kirkland. Is providing funding to American Indians, Alaska Natives, and Native Hawaiians a part of America's trust responsibility to tribes?
I think ensuring that the money that Congress appropriates to the Office of Indian Affairs is very important. I think it is very important to the office to prioritize how best to allocate those funds that Congress allocates to the Office of Indian Affairs.
I appreciate that.
To ensure that we're
Mr.
maintaining our
Kirkland,
trust
my time's about running out. I'm sorry to be rude. Mr. Kirkland, yesterday you're aware that Congress passed a rescissions package. So as you're in your position, Mr. Russell Vought has already said he's sending another one, and Congress really, it doesn't matter what they say about this. The executive branch is going to do it. Are you going to stand up and speak up to this administration if they choose to rescind appropriations passed by this Congress for tribal communities across America? The answer is yes or no.
Sir, once I'm confirmed, which I hope to be,
Okay, the answer is not yes. Do you think the administration cutting billions from national programs that support Indian country, Native American communities' lives lives up to America's trust responsibility?
sir, I look forward, once confirmed, to working with you, your staff, this committee, and most importantly, tribal leaders to prioritize the money that Congress appropriates for the Office of Indian Affairs to make sure it's best and most wisely invested.
I appreciate that, Mr. Kirkland. Right now, you stand alone in this administration because yesterday, all my Republican colleagues, most of them, voted to get this done. And Russell Vought has said he's sending another package before the sun even came up this morning. So you're alone in this. I hope that you are a man of your word and you speak up and stand up to this because we need some strong voices. And I hope that we have one in you, sir. You also talked about water, which I appreciate very much. It matters to us. Mr. Kirkland, do you know how much the president's budget, President Donald Trump, allocated for the Navajo Gallup Water Project?
Not offhand, no, sir.
$0. Is that okay?
I'm sorry?
Is that okay that the budget had $0 for the Navajo Nation water pipeline settlement?
Sir, if it was, I hope that we can put trillions of dollars into not just the Navajo's budget, but the Office of Indian Affairs. The facts are that
I agree with you.
our nation is facing a crippling national debt.
Okay, I don't know how to read that, so yes.
As I stated before, I look forward to working with
Mr.
you.
Kirkland, my
the committee, and
Republican
your
colleagues
staff.
just added $4 trillion to the debt, man.
I look
My
forward
question is, you in your testimony proudly spoke of your upbringing on the Navajo Nation, your ties to the nation, hauling water. Speaker Curley's right behind you. Other leaders are as well. One of the things I'm proud to represent is the leadership from the Navajo Nation, brothers and sisters there as well. For too long, America has ignored its trust responsibilities. This would be the first water settlement to fail. My question is a simple one. Is it okay or not that the President of the United States, who gave his commitment to the President of the Navajo Nation and other leaders that he would support the settlement, put $0 in the budget? This is an important question, Madam Chair.
I appreciate the question. I appreciate the enthusiasm.
Madam Chair, I'll yield back. If the answer is not yes, I'm worried about this. You know, my colleague talked about leadership qualities. Being honest and keeping your word matters. And I just certainly hope, Madam Chair, that as we're going through all of this, that we can find an honest way to tell people, if the answer to the Navajo Nation is they're not getting any money, then tell them. So that they can plan, they can budget, we can figure things out to help these people instead of an empty promise. I mean, Madam Chair, maybe I'm just tired.
I think we're all tired.
This is just frustrating.